Welcome to Catch Her Spark with Jen Maldonado. These are conversations with women who are building meaningful careers, stepping into leadership, and designing life on their own.
Oh my goodness. I'm super excited today because I know that there are people who practice medicine and there are those who shape the future of it through the life they touch as mentors, as and the people that they influence and the leaders they develop. And today we are joined by one of those women, Dr. Maria Escobar Vasco. And she is a physician, educator, and leader in endocrinology who has dedicated her career not only to patient care, but to mentor, innovate, and to prepare the next generation of medical professionals. And I know that she is from originally from Medellin to Colombia. And something that I love about her is that her journey reflects both depth and purpose. And from earning her medical degree to completing her training in San Antonio, Texas, and now she's serving as a program director for the endocrinology, diabetes, and metabolism training program at UT Health. Can you imagine, guys? So what makes her work so meaningful is not just the science itself or the system, of course, but the way she shows up for people, guiding, teaching, and creating impact that extends far beyond the clinic. Welcome, Maria. How are you today?
Hi, thank you, Jen, for having me here. I'm very excited about this podcast.
Yes, I'm very excited too. I mean, there's so much things that I want to ask you, and we're gonna have a short period of time. I'm like, no, but we're gonna make the most out of it. But I mentioned a little bit about what you do, but can you really explain? Because it's better when it comes from you. Can you tell us what do you do?
So, in terms of my job, first and foremost, I'm a physician. I did my medical school in Colombia, but then I came here to San Antonio, Texas, and I did first a specialization in internal medicine and then a subspecialization in endocrinology. And basically, what endocrinology means is we take care of patients that have mostly hormonal problems, including diabetes. It's a big thing that we do in endocrinology. We do thyroid, we do menopause, we do bone and mineral metabolism. And so in terms of what services I provide to our community as a physician, I do all these things based on hormone. Now, on top of that, like you were saying, I'm an educator. And so part of academic medicine, it's really training and mentoring the physicians of the future. And so I do training and mentoring for all sorts of different degrees of training. I have students that are coming from even pre-medical school to medical students, internal medicine residents, and then endocrinology fellows. And we do lectures or we do bedside education for them. We do a lot of different ways of teaching. So that's the two big pillars of what I do as a professional. It's patient care in endocrinology and then training and mentoring students in residents in endocrinology.
Wow, so you're super busy. That's what it
A
means.
little bit, yes.
So you don't have a dull moment for sure. Now, how did you get started into this line of work?
So when I went into medical school, what I really was thinking is I think the human body is such an amazing thing. I mean, how is it possible that such a little thing like a cell can do everything that it does and that it can all come together to produce a human person that can walk and eat and have rational and talk. And so to me, it was more of a this is interesting. What can we do with this? Through my career as a medical student, then I had to get involved with patient care. And then it was not only about what is functioning right and what is not functioning right, but also the stories behind that body that we were looking at. And so establishing relationship with patients, trying to understand what's going on. Is this something we can fix or not? And if we cannot fix, then what's the next step for this patient? And I really started enjoying that part of patient care, which at the beginning of my career was not part of my love for medicine. Then once I was like, okay, yes, this is something I want to do. I definitely want to be a clinician, not just a scientist. Came the question in what do I want to do? And I had no clue what I wanted to do. I was doing a little bit of research with some mentors in my medical school, but I really didn't know. And then I got a really good mentor that's actually currently here in San Antonio, Texas as well, who said, well, as part of my training, I did some outside rotations. I went to the US and I saw a different aspect of medicine. And I think that would be a good option for you to explore what else is beyond what we see here in medicine. Why don't you go and do that? So then I came here and I actually ended up here in UT Health San Antonio as a medical student, seeing a whole different aspect of medicine, how residents interacted, what internal medicine was. For the first time, I met who would be my mentor in endocrinology, Dr. John Bruder. And her passion for endocrinology, her passion for patient care was just contagious. And so that's when I said, this is what I want to do. I want to go back to the States. I want to do my training there. And I was already seeing that passion for mentoring and training, the way that other people mentored me and helped me down this path. Why shouldn't I do something like that? And throughout my training here, I really enjoyed when I had to do lectures for either the interns or the medical students. When I was kind of like the upper level, taking over the services and helping the interns coming in and showing us or showing them how to do things, then I really grew that desire to be part of academic medicine. Unfortunately or fortunately, I think it's a fortunate thing too. Once I was done with my training, because I was on a very specific type of visa, I had to go out of the system and do private practice for about 5 years so I could sort all my visa requirements and things. And even though I really liked what I was doing in patient care, I found myself really missing the education component of it. I missed having the students coming in, teaching. I missed giving conferences and lectures. And I started partnering with some of the residents from the University of the Incarnate Word that were starting their medical school program, giving some lectures here and there, but it was really not mentoring as much as it was just educating a big group of people. And so then I had the opportunity to come back to where I trained, to be part of academic medicine, to give a little bit back to a place that had given so much to me. And I took that opportunity and I have not regretted. It is a lot of work, but it's a very satisfying work. Like you said, there's no time, there's not a dual moment, because then I can split myself into doing patient care and still establishing relationships with my patients, but at the same time, I'm mentoring, I'm teaching, and giving lectures. And so it keeps my job very interesting and changing on an everyday basis. And so that's more or less how I ended up doing what I do.
I love it. I love it. I mean, it takes so much passion to do your type of work, right? My family, some of them are in that environment, doctors and nurse, and I can see the passion for the body first. And it takes a special person to do that, I have to tell you. But I see it when I can see it. I'm like, oh, this is going to be a good doctor or a good physician. And also, you have a big passion about teaching. I can see that how much I'm guessing that not only you master when you teach, but also you enjoy that. What keeps you motivated or inspired to teach and to practice endocrinology?
So many different things. I think one of the things that patients and students and residents have always appreciated of me is that I'm not here just to teach the science. I'm here to teach them about different aspects of medicine, including bedside manners and how to really focus on patient on the patient wellness and welfare. Same thing as for the students. And so some of my colleagues make fun of me because I say I'm pro-lunch, but I think that's important. I mean, as part of being physicians and being able to take care of other people, we also need to take care of ourselves. And so if we're not going to the restroom, believe me, I've had this happen before, or not having lunch and just spending hours and hours trying to solve problems and not being able to concentrate because you haven't had a minute to yourself. I think that also keeps me passionate about mentoring. It's not just about the science that you learn, but the person that you become as a physician, that wellness that you will transmit, the relationships you will build up. I think many patients have had experiences with very humane physicians, but also have experienced physicians that don't maybe have as well bedside manner, that they're really just about the science and there's no relationship to establish with their patients. That's not part of what they do. And I feel like it makes a difference when the patient really trusts you and you have a good relationship. It's a lot easier to take care of the patient, and I think outcomes are better. And because of the system that we live on, everything has to be quick. You're supposed to be seeing patients in 10, 15 minutes. The system is not designed for you to establish relationships. And as a group of people, healthcare has gone a lot into, this is now a business model and not so much a service model. So what do we do? And me being able to tell our trainees, we still need to be humane. We are human beings, and our patients are human beings before anything else, and we need to treat them as such. And showing them how that can be and helping them develop that part of themselves really gives me a lot of purpose into the teaching that I do. But the other thing too is I'm not getting any younger, and I'm starting to see some conditions in my close family members. My parents are not getting any younger. And so thinking about who's going to be taking care of us when we are in need. Do we really want these artificial intelligence drive robots to be taking care of everything in medicine and be establishing a relationship with us? Or do we still think that there is a human component to medicine and that we really need to train human beings that have this passion for what they do, that really want to establish relationships, so that when I get older and I need a physician, I have someone that can care for me or my parents or my husband or my kids the way I see myself caring for my patients.
I love it. I love it. I love the fact that you are shaping the future of physician on not only being good in technical stuff, scientific stuff, but who you become as a physician and shaping the future of humanity. Because with AI coming to play and many other services, I think that's going to be critical. And I love the fact that you consider how relationships can also help heal. And I think that people underestimate how important is that trust-based relationship between a doctor, whether it's a physician or a specialist, and the person receiving the treatment. It's I don't know if there's a way to quantify it, but psychological, and having that relationship allows this person to be treated how it's supposed to be. I love that. I love that. I hope that many other physicians and mentors are doing the same thing, because it's so needed, Maria. I admire that, and I knew there was so many special things from you and how you are really shaping the future. And to your point, I can see that's something that make you very proud. So now, talking about being proud about what you're doing, I would love to know, what does success means to you now that it wasn't used to?
Oh, that's a very hard question. Because everybody measures success very differently. And so that's why you're saying what it means to me. I think there's different ways that you can look at success. I mean, you can say that I'm a successful woman because I am a woman on a role that 30, 40 years ago was a men's job. I mean, most physicians were men. And then if you were trying to climb through the ladder of leadership, most of them were men. So you can say I'm successful because I'm doing a leadership role, that was not originally taken by a lot of women. Now, to me, really, that's not success. To me, success is that I consider myself lucky to be where I am, that I'm very happy doing my job. I think that to me is success. A lot of people do a job because they have to do a job, and for many reasons can do what they are passionate about or what they like. And I love what I do in my job. To me, that's a measurement of success. My family admires what I do and they support me on what I do. To me, that's a measurement of success. If my daughter, who's only 6 years old, can see that you have to be happy, that you have to be to do things the right way, and just fight for what you really think it's fair and true and what you want to do. To me, that's a measurement of success. Um, Maybe when I was younger, I was thinking, well, I have to be president of an institution or whatever to become successful. But my years in training and in what I do have taught me that it's not about where you are, but more how you feel about where you are.
Yeah. Oh, I love that. How you feel where you are. Yes. It's finding contempt in where you are today and being grateful. It just makes a big difference. And I'm so happy because you are working in your passion. And that's what a lot of people don't take the time to go there, right? Some people say, I just need to do the job for need, and they don't spend the time for X or Y reason. And that's super, super important. What are some of the myths or misconceptions in your field?
Oh, wow. Myths or misconceptions in my field. Um, Particularly in academic medicine, if you're trying to go through leadership, career advancement, a lot of people still think that this is a men's job. I think in many places it still is, but we're seeing a shift. And so maybe changing that way of thinking, that you have to be a male with certain degree of experience to really be able to have a leadership position in an academic institution. I think I'm lucky to be part of an institution that has allowed women to be in these positions. I have lots of different women physicians or that have doctorate degrees that are part of leadership and keep climbing, and they do what they love to do. And we're showing other people wrong that this is something that either gender can do. I think that's probably a concept that we're changing. Maybe it wasn't a misconception a couple of years ago, more than a couple of years ago, but it's a concept that we're changing for sure.
I love it. I love it. It's overcoming a resistance either from a mindset perspective of who can do this job and traditions and many other things that we're just putting some limitations, right, on what can be achieved by women. So, and that's another thing I love about you. You have become a role model, an example as a leader in this field. And that's why I was so excited to get to know you too, because we need more inspiration like that and showing women that they can do it. And there's such a particular thing of seeing a woman doing it versus a man. And I have excellent man mentors that they support us and things like that. But seeing the women, it just create a different type of flow and feeling. It just make it possible. And
Right.
I love that. I love that. Um, so what is, we start looking at the future. You mentioned that you have a daughter and you're becoming a role model. Tell me a little bit more about that legacy that you're building with her.
So I come from a family of very strong working women. My grandma was certainly someone that shaped a lot of what or who I am right now. Same as my mom. When my grandma was young and she was married and had 3 kids, my grandfather uh, go on bankruptcy, and she who was coming from a fairly well-established money-wise family had to start working to support her family. And throughout all of this and the way she raised my mom and my aunt, and then the way my mom raised me into her being a working mom, also being at home. So I don't know how she did to split herself so well between three daughters and her job and her husband. But always putting that in my mind that we are strong women, that we can do whatever we want to do. We just need to put the effort and concentrate on it. And me showing my daughter exactly that. I mean, we can do whatever we want to do as long as we concentrate, we do our best effort, and we do things right. And so my daughter has an amount of energy that's just abnormal. And I let her when she wants to do things that some people don't think it's for girls. And again, we're changing paradigms here. I let her. So the first thing she said is, I want to do martial arts. And for a lot of people, it's martial arts, a girl doing martial arts. And I'm like, this is amazing. Not only they give her discipline and she's training her physical body, she's training her mind, and then she'll be able to defend herself one day. I also have a son who's older. And
Mhm.
I teach him the same thing, and some of the things I try to teach him because uh, we're Latinos, and my husband is also from Latin America, and Latinos are very machista still. They still think that the man is the one that needs to carry for the house, and that things need to be done the way the man says. And my husband, even though was he was raised under a little similar concept. His mom was a physician and a working physician, so he understands that women also can be empowered to do that. And me also teaching this to my son, you need to respect women for what they are, and they can do the same things that you can do. And so you need to encourage that for whoever your partner in life is going to be. It's you both need to do what you want to do, and you both need to concentrate efforts to get to where you want to be. Now, as a human being, your own, because obviously he's a teenager, so he's not married or anything. But in the future, depending on what relationships you want to build, and it doesn't mean that you have to have a family if you don't want to, but if you do, making sure that you're working together towards that, towards we can both be working people, we can both achieve what we want, but we need to be a partnership.
Yes. Yeah, I love that. I love that. Shaping both the girls and the guys, right? That's amazing. Yeah, especially coming from Latino community, I can relate to your girl. I'm so happy that she's practicing martial arts. I used to practice Taekwondo to compete towards the Olympic team. So I know what it takes, and discipline, confidence, strength, and your mindset, in your heart, in your decisions. That's what some of the things you get from martial arts, besides learning how to, defend yourself physically. I love it. I love it. I'm so happy that you're supporting that. Yay. So excited. Now, talking about the future, because I think this is important. And one, I want to congratulate you for all the success you have done, for being content, for shaping the future, Maria, because that's amazing, right? And preparing future generations of physicians. One of the things I have learned, especially during these years, things changing for women, is I'm not sure about your situation, but many of the people or women I speak with, your like in your careers, they're doing incredible successful in their careers or business, but that success usually come with long hours and a lot of responsibility. And some people start thinking about the future when they want to do certain things, but also how they want to keep that level of income, but not work so hard for it. They start asking questions on how they can create income beyond the work they do every day. Things like investing in stocks, bonds, or get financial partners, real estate, crypto, silver, any of those things. What are your thoughts about creating income outside of work? Because you come from background that women were working really hard for it in long hours.
I think, unfortunately, because of the way medicine is going right now, it's a must. I mean, if you want to stay in academic medicine, you can probably make, if not twice, almost twice in private practice compared to academic medicine. And so this is a big thing for us, and a big reason why it's very hard for us to recruit people into academic medicine. It's the payment is very different. And so you certainly have to have a passion for it and a desire to do it. And so yes, a lot of people are looking into what else can I do to have financial solvency so that that I don't have to give up what I love doing. And sometimes we can find added things through the things that we still have passion about. So being an educator outside of the academic home that I have and giving some lectures outside. I've had some people doing recorded lectures and creating like CME opportunities online for other people. That's a way of income. And then I am lucky, I think, that I have a really good everything relationship with my husband, including financial relationship with my husband. And so we've built some of this thinking of the future. And he's a physician as well, but he does have training in business as well. And so he's the one that knows about the stocks and and he teaches me a little, but we work together into funding this future money solvency so that we can continue doing what we love. And he has been very supportive. He knows, and he's told me a couple of times, you can do much more if you go to private practice. But he sees the passion that I have for this. And so we just work around that into saying, okay, do we need to really do more investment, or should you start doing a little bit more extra shifts to get a little extra money? But let's make sure we're balancing this, because we also want to be with our family. And so sometimes it's a little balancing act. Some months are easier than others because it depends on how much workload we have. But that's one thing that I would say. If family makes you happy, you need to make time for your family. We tend to think, again, because of the backgrounds where we are coming from and the culture that Latinos have, that if you're not successful in your job, then you're not successful at all. Or some women that are thinking differently. If you don't have a family, then you're not successful. And I would say you are successful as long as you're happy with what you do. To me, my family is very important. My kids are very important, and I always make time for them. Maybe I could do a lot more in my job if I didn't focus so much in my family, but that's not what I want to do. I think I'm doing a good impact on the trainees. I don't need to be a higher administrator in this institution to feel successful, but I do need to know that my family is okay and that we are happy as a family to be successful. And this is not something that I would have told you 20 years ago. 20 years ago, I was thinking it's all about my career. My focus is my career. And for some of my cousins, for example, it was my family, it's my vision and my success. And I've seen everything. I've seen people who just went into their career and they're happy. But I also see people that went into their career and they never created any social bonds beyond that. And now they don't feel as happy as they thought they would be. And so just listen to yourself. Try to see really what it's your measurement of success, what makes you happy, and do it. Don't think that because you're a professional woman, you don't have a family, or because you have a family, you cannot be a successful professional woman.
I love it. I love it. I mean, it's been evolution in the way that you're thinking, beliefs that have grown, right? Who you used to be. And it's so important what you're saying, like define with clarity what makes you happy and what success means to you and your own.
And that can change, like I was showing you. I mean, when I was in medical school, I never thought I was going to get married and have kids. To me, it was all about my career. And then I'm here doing residency and I meet my husband and I'm like, okay, maybe now what makes me happy, it's two different things. And my kids, I absolutely adore them and they make me happy. And so that can change. It doesn't mean that the person you thought you wanted to be when you're 15 or 20, it's the person you are when you're 40. Just make sure that you're shaping your life around what means the world to you, what makes you happy.
Wow, I love it. Well, have a couple of questions more for you. What is a conversation? You brought that up and you just triggered this question for me. what is a conversation you wish more women were having, but are not yet?
Like with themselves or?
Yeah, with the friends, with themselves. What kind of conversation you wish that more women were talking about?
What makes you happy? What
Mhm.
makes you happy? What is it that you envision yourself doing, not what anybody else envisions you to be doing? Don't ask your mom, what do you think I should do with my life? Or mom, what is it important for my life? Is it my family? Is it my work? It's really thinking about what it's important to you. What makes you happy? What is your measurement of success? Um, and I have some friends that are all very highly achieving women too. Some of them physicians, some of them are engineers, and they also have careers in academia. And when we're talking and sitting, many of us have families too, and we're a big support group, and we talk about little things and we talk about big things together. And so just find also people around you that have similar values that you think can empower you to do what you want to do. If you want to be a successful person in your career and your family, or you're not thinking about family as making you happy, then make sure you're not just talking to people who put family first and they don't care about their career, because they're not going to empower you to do it. Listen to maybe some advice from other people, but make sure that the people that you're listening to and that you're trying to shape some beliefs around are people that share your measurements of success and what makes you happy.
Yes, I love it. I love it. And I love the fact that you are mentioning this balance because I can see some people going both sides completely. And especially for women like us, successful, busy careers, executive, what would you tell a woman who feels successful but restless?
To look deep inside to see why they're restless. What is it missing? What it's missing from your life? What it's missing in your heart that makes you restless?
Yeah.
And try to find what it is and try to go for it. Because otherwise you'll never be feeling completely happy, completely full, or completely successful. Many women who I see maybe under my eyes successful may not think they are because something's missing. So look deep into you. Don't ask other people, because other people are not going to know what's missing in your life. Ask yourself, what's missing in my life?
That's right. That's right. Love it. Love it. And we're getting to the end, Maria. No, we must do another episode or something with one of your students and have fun. But if people wanted to connect with you, know more about you, what's the best way for them to do that?
I would say, oh, that's a hard one. Because I'm not big social media person. Maybe work on that. Maybe I left that a little bit behind because I've been focusing on other stuff, but probably through my professional webpage, which is through the University of Texas Health San Antonio under the Department of Endocrinology. My phone number and my emails are there, and so they can reach out. If I can be in any way a mentor in what I do for other people, people that are thinking going into healthcare careers, or just someone wanting to ask about journeys, I would be happy to help. And maybe I need to start working on my social media.
People want
My
to know
husband certainly says so, but
it's like, let me see what you're doing, Maria. Well, thank you so much for taking time and being with us and sharing your story with the audience. I know you're going to inspire many other women, and they will be happy to hear about these podcasts and your life. Thank you,
thank you.
Maria.
I'm really honored to be part of this, and hopefully this, like you said, just gives a little light into some people that don't know what to do with their future.
Thank you.
Thank you.
You've been listening to Catch Her Spark with Jen Maldonado, where bold women lead the way. Ready to share your spark? Apply to be a guest at catchherspark.com/guest.